Thank you very much for accepting the invite to this month's Thought Leadership Series and also Press Club event. So, to our guests, welcome to this important event, which is a series of thought leadership sessions that will help, especially in health and development, that will help editors and reporters to get more knowledge, get more equipped in the areas of health and development in order to improve on coverage. The Director General, Ministry of Health, Dr. Patrick Amoth, Dr. Willie Sakwale, the Advisor and Malaria Council, Dr. Githinji Gitahi, Group CEO, Amref Health Africa, Dr. Rose Oronja, Director of Public Policy and Knowledge Translation, and the Head of Kenya Office at the African Institute for Development Policy, AFIDEP, Dr. Mercy Korir, the CEO and Editor-in-Chief of Willow Health Media, Dr. Mark Eric Gitahi, the CEO of Development Dynamics, and our moderator, the Editor-in-Chief of De Frontera Media, Anne Mawathe, members of the Executive Council of the Kenya Editors Guild, senior editors and members of Kenya Editors Guild, members of the media, ladies and gentlemen, good morning. Good morning once again, and welcome to this month's Thought Leadership Series. On behalf of the President of Kenya Editors Guild, allow me to welcome you once again and to introduce the various cadres of journalists in the House. So I'd like to acknowledge that Kenya Editors Guild is a professional association for senior editors in Kenya, and it is run by the Executive Council. So I'd like to acknowledge the presence of the Executive Council members in the room. We have Linda Batch, who is council member for print. Thank you. And we also have Agnes Mwangangi, who is the council member for radio. Thank you. And we also have members of Kenya Editors Guild. Kindly stand up, members of Kenya Editors Guild. All right, makofi kwa tafadhali. And members of the Kenya Editors Guild Secretariat. Thank you very much. And also, we have members of the media present, our beneficiaries, our supporters, our partners in media. So stand up, the members of the journalists present. Let's clap for them. Thank you very much. We don't walk alone, we walk with the journalists in the newsroom in all our events. So thank you very much and welcome. We would like to thank our development partners, the various institutions represented, for responding to the invite to be present to today's Thought Leadership Series for an important and critical issue affecting the health and development sector. That is funding. But before we deep dive into that, into what we'd like to achieve today, I'd like to give a short introduction of the work of Kenya Editors Guild and the milestones that we'll look at. It is the association for senior editors in Kenya with up to 300 members who are senior editors in the various cadres of journalism, that is television, print, academia, radio, and digital media. And we execute our work through a secretariat with staff running the day-to-day programs to ensure that programs are delivered to the members. Our work cuts across thematic areas, which include membership development, which allows members, which allows the Guild to develop its members. So today's meeting is part of our work in membership development, which also offers an opportunity for networking and serves as a platform to allow editors to interact with experts on key issues and today's issue being health and development. In contributing to the development of the media industry, we undertake training of the next generation of editors and who are journalists, both in the newsrooms and journalists in the journalism training institutions. And this is done in collaboration with the journalism schools with a mission of promoting professionalism and excellence in journalism. We are committed to bridging the gap between academia and industry, and that is why we endeavor to incorporate journalism, the reporters and also students in our activities. As editors, we also engage community members through town hall meetings, which is aimed at taking the media to the people to allow members of the public to understand what the media does, how editors make their decisions to publish or not to publish. While our work as a media association cuts across Kenya, we have also established collaborations with media associations both in Kenya and in the region, and Kenya Editors Guild currently serves as co-convener of the Kenya Media Sector Working Group, which is a coalition of media actors bringing together journalists and other civil society organizations, and we work to deliberate on the operating environment of media, guided by Articles 33, 34, 35, 36, and 37 of the Constitution of Kenya, which speaks to freedoms of expression, access to information, and assembly. Turning to today's meeting, our mandate being to promote professionalism and excellence in journalism calls us to focus on accuracy and keenness in how we report on health matters, and to endeavor to exceed our reporting frontiers as journalists. That's why we assembled today's Thought Leadership series to allow experts to take us through in discussing the impact of official development assistance this cuts on health and development in Africa. So from today's discussions, we would like our development partners and reporters and editors in the room to leave with increased public and media awareness. Journalists and reporters and editors need to be better informed about the implications of the official development assistance cuts. What happens when the aid that we so relied upon gets cut short? And we also want reporters to be equipped to report compellingly on their impact on health and development outcomes, especially in Kenya and in the wider region. From today's meeting, we would like to understand better policy and financing gaps. We would like to identify those through the experts in the room. What are the policy and financing gaps? And how can these urgent gaps in public health financing, particularly around maternal health, child, infectious diseases, programs such as malaria, and highlighting areas requiring immediate attention or bridging support. From this meeting, we also like to reframe the narrative on the African agency. The session advances a narrative to co-responsibly with clear articulation on the roles of African governments and private sector actors and philanthropists must play. What role must they play in financing sustainable health systems? As Kenya Editors Guild, it's our business to report accurately, and therefore from these sessions, we hope that reporters and editors in the room will come out with a bag of story ideas and a lot of insights that will help to better their reporting in health and development. As journalists, it's our duty to verify information and act as a second layer of defense against incorrect information. We have experts in the room. It's our business to ask the right questions, question and get the right answers. So as professionals, Let us delay the gratification to publish first and fast check first. Noting extremes in funding, as we will realize today, instituted by the development partners, and the dwindling nature of the space, we urge media to embrace collaborations with Kenya Editors Guild to achieve this mandate. We also call upon the development partners to continue to partner with media in trainings, in continuous trainings, in the continuous professional development, in line with our mandate of promoting professionalism and excellence in journalism. And finally, we welcome collaboration with all our partners in the room for our continued programs, and especially on our annual Editors Convention, which will be held in November 2025. Thank you very much for attending this event, and we hope that it will be a great learning process. Karibuni.